Question 1. What is the main purpose of ongoing supervision for an RBT? A. To ensure the RBT arrives on time for sessions. B. To provide support, training, and oversight to the RBT in their work with clients. C. To determine the RBT's salary and benefits. D. To complete administrative paperwork for the RBT. Answer. B. To provide support, training, and oversight to the RBT in their work with clients. This question asks about a core requirement for maintaining your RBT certification and ensuring quality services. Ongoing supervision by a BCBA or BCABA is designed to support your growth as a behavior technician, provide necessary training on client programs, monitor your implementation of procedures, and ensure you are working effectively and ethically with clients. Your supervisor is responsible for overseeing your clinical work, not your attendance, pay, or administrative tasks. Think of supervision as your regular check-in with your coach to make sure you're running the plays correctly and improving your skills. Question 2. If a client bites their hand and you immediately provide attention by saying "no biting," and the hand biting increases in the future, the function of the hand biting is likely: A. Escape. B. Access to tangibles. C. Automatic reinforcement. D. Attention. Answer. D. Attention. This question asks you to identify the function of a behavior based on the consequence provided and its effect. The behavior is hand biting. The consequence is you providing attention, no biting. The result is the hand biting increases. When a behavior increases because it is followed by attention from others, the function is attention. Escape is getting away from something. Access is getting a toy or activity. Automatic reinforcement is internal. Since your attention made the behavior more likely, attention is the function. If the behavior gets you noticed, it's likely attention. Question 3. In the ABC framework, what does the B represent? A. Before. B. Background. C. Behavior. D. Belief. Answer. C. Behavior. This question tests your understanding of the fundamental ABC model used to analyze behavior. The ABC stands for antecedent, behavior, and consequence. The B is the central part of this model and refers to the specific observable action or response that the person is doing or saying. The A comes before the B, and the C comes after the B. Behavior is simply the action you are trying to understand or change. Question 4. You are collecting data on a client's hitting behavior using whole interval recording with 1-minute intervals. For an interval to be marked as yes, the hitting must occur. A. At any point during the 1-minute interval. B. For the entire duration of the 1-minute interval. C. At the very end of the 1-minute interval. D. Multiple times within the 1-minute interval. Answer. B. For the entire duration of the 1-minute interval. This question tests your knowledge of whole interval recording, a specific type of discontinuous measurement. In whole interval recording, you mark yes for an interval only if the target behavior occurs continuously throughout the entire length of that interval. If the behavior stops even for a moment within the interval, you would mark no. Partial interval is any point, A, and momentary time sampling is at the end, C. Frequency counts occurrences, D. For whole interval, the behavior must fill up the whole time block. Question 5. If a behavior is followed by the removal of something unpleasant, and the behavior increases in the future, this is called A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer. B. Negative reinforcement. This question asks about a principle that increases behavior by taking something away. The clues are followed by the removal of something unpleasant, negative, and behavior increases in the future, reinforcement. When a behavior leads to getting away from or avoiding something aversive, and that makes the behavior more likely, it's negative reinforcement. Positive reinforcement adds something pleasant. Punishment decreases behavior. If you turn down loud music, unpleasant, by pushing a button, behavior, and you push that button more often when the music is loud, that's negative reinforcement. The behavior got reinforced because something bad was removed. Question 6. What is the most important aspect of defining a behavior for data collection? A. Using technical ABA terms. B. Ensuring the definition is objective and measurable. C. Describing the likely function of the behavior. D. Making the definition short and easy to remember. Answer. B. Ensuring the definition is objective and measurable. This question highlights a critical step in ABA practice, defining the behavior clearly. For data to be accurate and consistent across different RBTs, the definition of the target behavior must be objective, describing what you can see or hear, not feelings or interpretations, and measurable. You can count it, time it, etc. This allows anyone observing the client to agree on whether or not the behavior occurred. Technical terms. A. Aren't necessary. Function. C. Is important but not part of the definition. Easy to remember. D. Is helpful but secondary to being objective and measurable. A good definition is clear enough for anyone to use consistently. Question 7. An RBT is asked by a client's parent how to reduce a challenging behavior at home that is not currently addressed in the behavior plan. What is the RBT's most appropriate response? A. Provide the parent with a simple strategy based on your experience. B. Explain that you are not authorized to give clinical advice or modify the plan, and they should discuss this with your supervising BCBA or BCABA. C. Tell the parent you will add the behavior to the plan and start collecting data. D. Refer the parent to a different RBT who has more experience with that behavior. Answer. B. Explain that you are not authorized to give clinical advice or modify the plan, and they should discuss this with your supervising BCBA or BCABA. This question addresses the RBT's scope of practice and communication boundaries. RBTs are implementers, not clinical supervisors or consultants. You are not qualified or authorized to give parents advice on behavior change strategies or modify the client's plan. Your ethical responsibility is to explain your role limits and direct the parent's request to your supervisor, who is responsible for all clinical decisions and parent consultation. Stay within your lane and direct clinical questions to the BCBA. Question 8. When teaching a new skill, you provide extra help to ensure the client gives the correct response, and then gradually reduce that help over time. The process of gradually reducing the help is called A. Shaping. B. Prompting. C. Fading. D. Generalization. Answer. C. Fading. This question asks about the process of reducing assistance during learning. The key phrase is gradually reduce that help over time. This systematic reduction of prompts is called fading or prompt fading. Prompts are the initial help provided. B. Shaping is reinforcing approximations to a target behavior. A. Generalization is performing the skill in new settings. D. Fading is essential to help the client become independent from the prompts. Slowly taking away the help is fading the prompt. Question 9. If a client is taught to respond to the instruction clap hands and eventually performs the clapping behavior whenever they hear the instruction clap hands, but not when they hear stomp feet, this demonstrates A. Generalization. B. Maintenance. C. Discrimination. D. Shaping. Answer. C. Discrimination. This question asks about learning to respond differently to different cues. The client is learning to discriminate, or tell the difference between the instruction clap hands and the instruction stomp feet, and perform the correct behavior for each. Generalization is responding similarly to different stimuli/settings. Maintenance is performing the skill over time. Shaping is reinforcing approximations. Learning which specific cue leads to which response is discrimination training. You're teaching them to know when to do it and when not to based on the signal. Question 10. Which of the following is the earliest appropriate information to include in a client's session notes? A. Objective data points example frequency, duration, percentage. B. Description of challenging behavior occurrences in observable terms. C. Subjective opinions about the client's personality or family. D. Progress on skill acquisition goals. Answer: C. Subjective opinions about the client's personality or family. This question asks you to identify what not to put in professional session notes. Session notes must be objective, factual, and based on observable events and data. Including personal opinions or subjective judgments about the client's personality, feelings, or family is unprofessional and inappropriate. Focus on measurable behavior, collected data, and program progress. Keep your notes factual and professional, not personal or opinionated. Question 11. When conducting a functional behavior assessment, FBA, the main goal is to A. Teach the client new communication skills. B. Identify the antecedents and consequences that maintain challenging behavior. C. Reduce challenging behavior immediately. D. Conduct preference assessments to find reinforcers. Answer: B. Identify the antecedents and consequences that maintain challenging behavior. This question asks about the purpose of an FBA, which aims to understand why a challenging behavior happens. An FBA involves looking at the A, B, C components, the antecedents that trigger the behavior, and the consequences that reinforce it, to determine the behavior's function. Example: attention, escape, access, automatic. This information is then used to develop an effective intervention plan. It's not about teaching skills. A. Immediate reduction. C. Or just finding reinforcers. D. Although all these might be related to the overall treatment, the FBA's core job is figuring out the why by analyzing the ABC pattern. Question 12. What is the ethical responsibility of the RBT if a client begins to engage in a behavior that poses immediate risk of serious harm to themselves or others, and the RBT feels unsafe? A. Continue trying to implement the behavior plan as written. B. Use any means necessary to stop the behavior. C. Use only trained crisis procedures to ensure safety and contact supervisor/emergency services immediately. D. Leave the area immediately to protect yourself. Answer: C. Use only trained crisis procedures to ensure safety and contact supervisor/emergency services immediately. This question is about responding to dangerous crises ethically and safely. If a client's behavior creates an immediate risk of serious harm, your priority shifts entirely to safety. You must use any crisis prevention or physical intervention procedures you have been specifically trained to use for that client in their crisis plan, and immediately contact your supervisor or emergency services as warranted by the situation and company policy. Continuing the plan, A, is inappropriate. Using any means, B, could be unethical or harmful. Leaving the client, D, might abandon them in a dangerous state. Safety using trained methods and getting help is paramount. Question 13. What is the term for presenting reinforcement after a set number of correct responses? A. Fixed interval, FI. B. Variable interval, VI. C. Fixed ratio, FR. D. Variable ratio, VR. Answer: C. Fixed ratio, FR. This question asks about a specific reinforcement schedule based on a fixed count of responses. Fixed means the number is unchanging, and ratio means it's based on the number of responses. So fixed ratio, FR, means reinforcement is delivered after the client performs the target behavior a specific, consistent number of times. Interval schedules, FI and VI, are based on time. Variable ratio, VR, has a changing number of responses. If the rule is do it X times, get reinforcement, and X is always the same, it's a fixed ratio. Question 14. You are teaching a client to get dressed using a task analysis. You help the client with all steps except the last step, putting on shoes, which they complete independently. You reinforce them when they put on their shoes. Once mastered, you help with all steps except the last two, and reinforce when they put on their socks and shoes. This is an example of A. Forward chaining. B. Total task chaining. C. Backward chaining. D. Shaping. Answer C. Backward chaining. This question describes a specific method for teaching multi-step tasks, a task analysis. The key is that you are teaching the steps in reverse order, starting with the client mastering the last step independently, and then adding the second to last, and so on. This is backward chaining. Forward chaining starts with the first step, and total task chaining attempts all steps in each trial. Shaping is for single behaviors. Backward chaining works backwards through the steps. Question 15. What is the ethical principle that relates to being honest, truthful, and accurate in your professional conduct, including documentation? A. Confidentiality. B. Integrity. C. Beneficence. D. Client dignity. Answer B. Integrity. This question asks about an ethical principle guiding your behavior as a professional. Integrity means being honest, being truthful, and acting with accuracy and consistency between your values and actions. This is crucial in ABA practice, especially in documentation, where you must be truthful and accurate in recording data and session notes. Confidentiality is about privacy. Beneficence is doing good. Client dignity is about respect. Integrity is about being truthful and honest in everything you do as an RBT. Question 16. When implementing an extinction procedure for a behavior maintained by attention, you should A. Provide attention contingent on the behavior. B. Withhold attention contingent on the behavior. C. Provide attention for a different, appropriate behavior. D. Provide a tangible item contingent on the behavior. Answer B. Withhold attention contingent on the behavior. This question asks how to apply extinction for a behavior that is happening to get attention. Extinction involves stopping the reinforcement that is maintaining the behavior. If the behavior is maintained by attention, the extinction procedure is to withhold attention immediately after the behavior occurs, provided it's safe to do so. Providing attention. A. Providing a tangible. D. Or reinforcing other behaviors. C. This is part of differential reinforcement, often used with extinction, but extinction itself is withholding the reinforcement for the target behavior. Would not be the core extinction procedure for attention. To extinguish an attention-seeking behavior, you stop giving attention for it. Question 17. If a client is learning to identify objects by their function, example, pointing to a spoon when asked, "What do you eat with?" This is primarily targeting. A. Manding. B. Tact. C. Echoic. D. Listener responding. Answer D. Listener responding. This question describes teaching a client to respond to a verbal cue by identifying an object based on its function. The client is listening to your question, "What do you eat with?" and making a nonverbal response, pointing to the spoon. This falls under the category of listener responding, where the client responds nonverbally to verbal stimuli. Manding is requesting. Tact is labeling, saying spoon when seeing a spoon. Echoic is repeating. Understanding and responding nonverbally to what someone says is listener responding. Question 18. What is the purpose of collecting baseline data? A. To show parents how much progress the client has already made. B. To get a measure of the behavior before intervention to compare against later data. C. To determine if the behavior is problematic enough to require intervention. D. To make the behavior occur more frequently. Answer B. To get a measure of the behavior before intervention to compare against later data. This question asks why we collect data before starting an intervention. Baseline data is collected on a behavior or skill in its natural state, before any new teaching program or behavior plan is implemented. This gives you a starting point or baseline level of the behavior's occurrence. Later, Once the intervention is in place, you compare the data collected during intervention to the baseline data to see if the intervention is effective in changing the behavior. Baseline shows you the behavior before you tried to change it. Question 19. What is the ethical term for treating clients with respect, enabling choices, and protecting their privacy? A. Confidentiality. B. Client dignity. C. Professionalism. D. Informed consent. Answer B. Client dignity. This question asks about an ethical principle focused on respecting the individual client. Client dignity involves treating clients with respect, providing opportunities for choice and self-determination, and being considerate of their privacy and rights. Confidentiality, A, is specifically about protecting private information. Professionalism, C, is broader conduct. Informed consent, D, is a process related to agreeing to services. Client dignity is about respecting the client as a person. Question 20. You were tracking data on a client's tantrum behavior. You set a timer for 5-minute intervals and record if the tantrum occurs at the exact moment the timer beeps. What measurement method are you using? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Duration recording. Answer C. Momentary time sampling. This question asks about a specific discontinuous measurement method based on checking at a precise time. The key phrase is record if the tantrum occurs at the exact moment the timer beeps. This is the defining characteristic of momentary time sampling. Partial interval records if it occurs at any point, and whole interval records if it occurs throughout. Duration measures how long. Momentary time sampling is a snapshot at the end of the interval. Question 21. What is the difference between a manned and attacked? A. A manned is labeling. Attacked is requesting. B. A manned is evoked by a motivating operation, MO, and reinforced by getting the requested item, while attacked is evoked by a nonverbal stimulus and reinforced by generalized praise. C. A manned is repeating. Attacked is conversing. D. A manned is verbal. Attacked is nonverbal. Answer B. A manned is evoked by a motivating operation, MO, and reinforced by getting the requested item, while attacked is evoked by a nonverbal stimulus and reinforced by generalized praise. This question asks you to differentiate two core types of verbal behavior based on their controlling variables: antecedent and consequence. A manned is a request, like saying water because you are thirsty, controlled by a motivating operation, MO, and reinforced by getting the requested item. Attacked is labeling something you perceive, like saying water because you see water, controlled by a nonverbal stimulus and reinforced by generalized conditioned reinforcement, like praise or a token. This is a key distinction in analyzing verbal behavior. Manned is motivated by wanting it, tact is labeling it. Question 22. When using a token board system, the items or activities the client earns the tokens for are called: A. Conditioned reinforcers. B. Primary reinforcers. C. Backup reinforcers. D. Stimulus control. Answer C. Backup reinforcers. This question is about the different parts of a token economy system. The tokens themselves become conditioned reinforcers. The items or activities that are exchanged for the collected tokens are called the backup reinforcers. These are the things that give the tokens their value in the first place. Primary reinforcers are biological. Stimulus control relates to a behavior happening in the presence of a specific cue. The backup reinforcers are the ultimate prizes in a token system. Question 23. If a client consistently performs a skill when the specific instruction is given, SD, but does not perform it when a different, similar instruction is given, S, the behavior is under A. Generalization. B. Discrimination. C. Extinction. D. Spontaneous recovery. Answer B. Discrimination. This question asks about the outcome of discrimination training. When a client learns to respond appropriately in the presence of one stimulus, the SD, and not respond or respond differently in the presence of another stimulus, the S, they are discriminating between the two stimuli. Generalization is responding similarly to different stimuli. Extinction decreases behavior. Spontaneous recovery is temporary reappearance after extinction. Learning which signal means do it and which means don't do it is discrimination. Question 24. What should you do if you receive a program update or modification from your supervisor during a session? A. Finish the current session using the old program and implement the update next session. B. Stop the session immediately to thoroughly review the update. C. Briefly review the update and implement it as soon as is practical and safe within the current session. D. Put the update aside and review it before your next session. Answer: C. Briefly review the update and implement it as soon as is practical and safe within the current session. This question is about implementing program changes efficiently and correctly. Program updates are given to improve interventions and should be implemented promptly to benefit the client. While you need to understand the change, the most appropriate action is to briefly review the update and incorporate it into the current session as soon as it makes sense to do so without disrupting the flow or causing issues. Waiting until the next session. D. Delays effective treatment. Stopping the session entirely. B. Is usually unnecessary unless the change is complex or critical. Implement the update as soon as you can safely and accurately within the current session. Question 25. What is the ethical term for promoting the client's overall welfare and benefit? A. Autonomy. B. Justice. C. Beneficence. D. Fidelity. Answer: C. Beneficence. This question asks about an ethical principle focused on doing good. Beneficence means working for the client's benefit and promoting their well-being. It's about ensuring the interventions are effective and contribute positively to their life. Autonomy is about choice. Justice is about fairness. Fidelity is about loyalty/trustworthiness. Beneficence is the principle of acting in the client's best interest to do good. Question 26. When collecting frequency data, in addition to the count, you must also include A. The time the behavior occurred. B. The person who delivered the consequence. C. The duration of the observation period. D. Your subjective opinion about the behavior. Answer: C. The duration of the observation period. This question is about making frequency data meaningful. A raw count, the behavior happened 10 times, isn't very useful without knowing how long you were observing. Including the duration of the observation period example 10 times in 30 minutes allows the supervisor to calculate a rate, occurrences per minute/hour, which is a more standardized measure for comparison. Time of day, A, and consequence details, B, are important for ABC data, but not essential for basic frequency/rate. Subjective opinions, D, are never included. You need the count and the time you spent counting to make sense of frequency data. Question 27. If a behavior occurs less often in the future because a desirable stimulus was removed immediately after the behavior, this is called A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: D. Negative punishment. This question asks about a principle that decreases behavior by taking something away. The clues are less often in the future, punishment, and a desirable stimulus was removed immediately after, negative. When you take away something the client likes after a behavior, and that makes the behavior less likely to happen again, it's negative punishment. Taking away video game time, desirable stimulus removity. Because a teenager yelled, behavior, and the yelling decreases, is negative punishment. Question 28. What is the primary role of an RBT in the functional behavior assessment, FBA, process? A. Conducting direct assessments like functional analyses. B. Developing hypotheses about the function of behavior. C. Implementing specific data collection procedures like ABC data or interval recording as directed by the supervisor. D. Writing the FBA report and behavior plan. Answer: C. Implementing specific data collection procedures like ABC data or interval recording as directed by the supervisor. This question clarifies the RBT's specific contribution to the FBA process, while FBAs are conducted by supervisors. BCBA/BCABA. RBTs play a vital role by collecting objective data on the challenging behavior and its context, antecedents, and consequences. Under the supervisor's guidance, RBTs could not design complex assessments. A. To develop the hypotheses. B. Or write the reports/plans. D. Your job is to be the data collector, gathering the information your supervisor needs to understand the behavior's function. Question 29. When should you seek clarification or support from your supervising BCBA or BCAA? A. Only during your scheduled supervision meetings. B. Whenever you have a question about a program, encounter a challenging behavior you're unsure how to handle, or have concerns about client safety or well-being. C. Only when you are completing your competency assessment. D. Only if you are about to make a major change to a program. Answer: B. Whenever you have a question about a program, encounter a challenging behavior you're unsure how to handle, or have concerns about client safety or well-being. This question is about knowing when to reach out to your supervisor. You should proactively contact your supervisor whenever you need clarification on a program, are unsure how to apply a procedure, face unexpected challenges, or have any concerns related to the client's safety, health, or welfare. You don't have to wait for a scheduled meeting for important issues. They are there to support you and ensure quality services. Don't hesitate to ask for help when you need it. Question 30. What is a conditioned reinforcer? A. A reinforcer that is effective because it meets a biological need, example, food, water. B. A stimulus that was neutral but became reinforcing because it was paired with a primary or established conditioned reinforcer. C. A reinforcer that is only effective under certain conditions. D. A punishment procedure that is only used under specific circumstances. Answer: B. A stimulus that was neutral but became reinforcing because it was paired with a primary or established conditioned reinforcer. This question defines a conditioned reinforcer. Unlike primary reinforcers, A, which are naturally reinforcing, conditioned reinforcers are learned. They become reinforcing because they are consistently presented with or immediately before a primary reinforcer or another strong conditioned reinforcer. Praise, tokens, stickers, and money are common examples. Their value comes from being paired with things you really want. A conditioned reinforcer is a learned reward. Question 31. Which measurement method is best suited for behaviors that occur at a very high rate and don't have a clear start and end, making it difficult to count every instance or measure duration precisely? A. Frequency. B. Duration. C. Interval recording, example, partial interval. D. Latency. Answer: C. Interval recording, example, partial interval. This question asks you to select an appropriate measurement method for a challenging type of behavior to track. For behaviors that happen very quickly or constantly or are difficult to get an exact start/end time, continuous measurement like frequency, A, or duration, B, can be impractical or inaccurate. Interval recording methods, particularly partial interval recording, are useful for getting an estimate of the occurrence of such high rate or continuous behaviors. Latency, D, is about the time to start. For fast, ongoing behaviors, interval recording gives you a workable estimate. Question 32. In a task analysis, each individual step in the sequence acts as a cue for the next step. This is related to the concept of A. Discrete trial. B. Stimulus response chain. C. Prompt hierarchy. D. Variable schedule. Answer: B. Stimulus response chain. This question relates the steps of a task analysis to a concept in behavior analysis. A task analysis breaks a larger skill into smaller steps. When these steps are learned, performing one step produces a change in the environment that acts as a discriminative stimulus, SD, for the next step, and completing that step acts as an EST for the following step, and so on. This linked sequence of ESTs and responses is called a stimulus response chain. Discrete trials, A, are teaching units, prompt hierarchies. C, are about types of prompts and variable schedules. D, are about reinforcement timing. A task analysis breaks a skill into steps that become a chain of behaviors. Question 33. What is the ethical responsibility of an RBT regarding their training and competency? A, to only work with clients who have behaviors they are already familiar with. B, to accept any case assigned by their supervisor, regardless of their training. C, to inform their supervisor if they feel they are not competent to implement a specific procedure or work with a specific client population. D, to train themselves on new procedures by watching online videos. Answer: C, to inform their supervisor if they feel they are not competent to implement a specific procedure or work with a specific client population. This question addresses a crucial ethical guideline: working within your boundaries of competence. RBTs must be competent in the procedures they implement and with the populations they serve. If you are assigned a case or a procedure you haven't been trained on or don't feel competent to handle, your ethical duty is to immediately inform your supervisor so they can provide the necessary training or reassign you. You cannot simply choose cases: A, accept cases you're not ready for; B, or rely solely on untrained methods like watching videos; D, speak up if you need more training or support. It's your ethical obligation. Question 34. When is it acceptable for an RBT to discuss client information with someone other than their supervising BCBA/BCABA? A, when talking to the client's family members. B, when talking to other RBTs from the same company working on the same case. C, when talking to a friend who is also an RBT but works elsewhere. D, when talking to the client's teacher during a school session break. Answer: B, when talking to other RBTs from the same company working on the same case. This question tests your understanding of confidentiality and who is considered an authorized person. You can discuss client information with authorized individuals on the client's treatment team who have a professional need to know. This typically includes other RBTs from your company who are assigned to that specific client's case. Discussing with family requires specific authorization: A, discussing with RBTs from other companies; C, or potentially teachers without proper authorization or in an inappropriate setting. D, violates confidentiality. Share client details only with those directly involved in that client's treatment team within your agency. Question 35. What is the primary ethical consideration when selecting target behaviors for intervention? A, whether the behavior is easy to measure. B, whether the behavior can be changed quickly. C, whether the behavior is socially significant and will improve the client's life. D, whether the behavior is preferred by the RBT to work on. Answer: C, whether the behavior is socially significant and will improve the client's life. This question asks about a core value in ABA: selecting behaviors that matter. Applied behavior analysis focuses on changing socially significant behaviors, those that are important to the individual and their community and will improve their quality of life, safety, independence, or social functioning. While ease of measurement, A, and speed of change, B, are practical considerations, and RBT preference, D, is irrelevant. The ethical priority is choosing goals that will have a meaningful positive impact on the client's life. Focus on behaviors that make a real difference.